Yes, now I'll discuss about the anatomy of the elbow joint. Type of elbow joint is synovial and its variety is hinge variety. Articular surfaces are here. Before discussion about the articular surface, you can see here is radial fossa. This is radial fossa. This is radial fossa. Here is coronoid fossa. Here is this is capitulum. This is capitulum. This is capitulum. And here is coronoid process. This is coronoid process. And this is trochlea. This is trochlea. This is trochlea. In this diagram, here is this is trochlea. This is trochlea. Here is this is capitulum. This is capitulum. This is head of radius. This is lateral epicondyle. Here is medial epicondyle. Here is a depression that is olecranon fossa. This is olecranon fossa. So now, articular surfaces on superior side and upper part. Here is articular surface is formed by capitulum. This is capitulum and this is trochlea. The superior articular surfaces are formed by capitulum and trochlea. Inferior articular surface is formed by superior articular surface of the head of the radius. This is head of radius. It has superior articular surface. This is head of radius. It has superior articular surface. So inferior articular surface is formed by superior articular surface of the radius, and here this articular surface is this. This is a trochlear notch. This is trochlear notch. This is trochlear notch. So again, superior articular surface is formed by capitulum and trochlea. Inferior articular surface is formed by superior articular surface of the head of radius and trochlear notch. This is trochlear notch. Here is trochlear notch. This is trochlear notch. These articular surfaces are covered with hyaline cartilage. And ligaments related to this joint is, first of all, capsular ligament. Capsular ligament attached to the lower end of the humerus. It is in such a way that it covers this fossa. This is radial fossa. This is radial fossa. It covers radial fossa. In this diagram, here is radial fossa. This is radial fossa. So it covers radial fossa. And then it covers coronoid fossa. This is coronoid fossa. On medial side, here is coronoid fossa. This is coronoid fossa. It covers coronoid fossa. Then, from medial side, it covers the margin of that is articular surface of trochlea. This is trochlea, medial margin of the trochlea, and it posteriorly it covers the margin of olecranon fossa like this, and laterally here it covers like this. It covers like this. So anteriorly it covers like this. On lateral side and on medial side it covers like this. Infero-medially, this capsule attached with the margin of trochlear notch. This is margin of trochlear notch. It attached with the margin of trochlear notch, like this. And laterally, here, this is anterior aspect, and here is posterior aspect. Here is depression, that is olecranon fossa. So it attached with the margin of this depression and reflect like this. And here is annular ligament. This is annular ligament. This is annular ligament. This ligament is annular ligament. So inferolaterally it attached with the annular ligament. Infero-medially it attached with the margin of the trochlear notch. So this is attachment of the capsule. This is annular ligament. So this capsular ligament anteriorly is very thick. Here it is thick. Anteriorly it is thick. And posteriorly it is very thin. Here it is very thin. This is the region why in case of effusion of this joint, swelling occurs on posterior aspect here. Because it is thin here. So, and this is internally lined by synovial membrane. It is internally lined by synovial membrane. This is internal line. This is internally lined by synovial membrane. Here is the synovial membrane. So this is capsular ligament. This is capsular ligament. In this diagram, this is capsular ligament. It covers the joint. This joint is medially reinforced by the ligament, that is, this is medial epicondyle, this is coronoid process from here to here, and this is olecranon process from here to here, and this is oblique band. This is ulnar collector ligament. It has three bands. This is anterior band, this is posterior band, and this is oblique or inferior band. Here, at the site of three bands, it is thick, and in between these, it is thin. So this is ulnar collector ligament. This ligament is crossed by ulnar nerve. This is ulnar nerve. It passes behind the medial epicondyle of humerus from here, and it crosses this joint like this. This nerve becomes anterior to this. This is ulnar nerve, which crosses this joint from behind this medial epicondyle of humerus and just superficial to this ulnar collector ligament. And laterally, there is lateral or radial collateral ligament. This is lateral epicondyle and this is annular ligament. So here is, this is radial collateral ligament. This radial collateral ligament is attached with lateral epicondyle of humerus superiorly and inferiorly with the annular ligament. With the annular ligament, this ligament is annular ligament. So this is radial collateral ligament. Now, relation of this joint. If you cut a transverse section at this level, you will find here is lateral epicondyle. This is medial epicondyle. Here is capitulum. This is capitulum. This is trochlea. This is trochlea. And posteriorly, this is olecranon process. This is olecranon process. Structure attached with these structures. Here is enconius, and posteriorly here is triceps. This is triceps, and medially there is flexor carpi ulnaris and other muscles of this common flexor origin. Here is extensor carpi radialis brevis and other muscles of the extensor compartment which takes origin from the lateral epicondyle. And here is position of brachialis muscle. This is brachialis muscle. This is brachialis muscle. And here is joint capsule. This is covering of the joint capsule. This is joint capsule. Which is internally lined by synovial membrane. This is joint capsule. This is brachialis, and structures from medial to lateral side. This is median nerve. Then there is a brachial artery. This is brachial artery. Then there is biceps brachii. This is tendon of the biceps brachii. And there is a radial nerve. This is radial nerve. And here, behind the medial epicondyle, there is ulnar nerve. This is ulnar nerve. So these structures are related to this. This is transverse section, showing the relations of this joint. Here you can see this is ulnar nerve, this is median nerve, this is radial nerve. Three nerves crosses this joint. So these three nerves give supply to this joint. And there is another fourth nerve, musculocutaneous, which gives supply to brachialis, also gives supply to this joint. So there are four nerves which give supply to this joint. Ulnar, median, radial, and nerve for this, that is musculocutaneous. Its arterial supply is by the anastomosis around the elbow joint, which we will discuss in part 2, elbow joint, in next video. So these are the relations of this joint. Movement at this joint, there are flexion and extension. Flexors are biceps brachii. This is biceps brachii and brachialis. These two are flexors of the elbow joint. And in mid-prone position, brachioradialis is also flexor of this joint. Brachioradialis is also flexor of this joint. Extensors are and the muscles on the posterior compartment, that is triceps and enconius. These are extensors at this joint. So, and another important thing, that is carrying angle. Here is This is long axis of this. Here is transverse axis of this joint, and there is angulation between long axis of the arm and forearm. That this angulation is about 11 degree in male, about 14 degree in female. This is known as carrying angle. This carrying angle is due to this medial flange of the trochlea is about 6 millimeter lower than lateral flange. And this articular surface is not horizontal, this is oblique. This is oblique. And during flexion, this carrying angle becomes disappear, and during mid prone position, this angle becomes disappear. So this is all about the elbow joint. Thank you. Here you can see this is first rib. This is outer border of the first rib. This is subclavian artery, and from outer border of first rib to lower border of the teres major, this muscle is teres major. This is axillary artery from here to here. And here is continuation of axillary artery, like this. This is continuation of the axillary artery from lower border of teres major to radial tuberosity. This is radial tuberosity. Here in this diagram, you can see this is lateral intermuscular septum. This is medial intramuscular septum. Here is interosseous membrane between radius and ulna. This is interosseous membrane. So this artery gives a branch here. This is superior ulnar collateral artery which passes behind the medial intermuscular septum. This is superior ulnar collateral artery. This is superior ulnar collateral artery which passes descend downward behind this medial intramuscular septum. And the branch is there is inferior ulnar collateral artery. This is inferior ulnar collateral artery. It passes anterior to this intramuscular septum. This is also known as supratrochlear artery. This is inferior ulnar collateral artery, also known as supratrochlear artery. And here on lateral side, here a branch arises known as profunda brachii, which passes through radial groove. This is radial groove which is situated on posterior aspect of the humerus. It passes along with the radial nerve. Here is radial nerve in the radial groove, and here in the lateral side, this artery gives a branch. One branch which lies behind this lateral intramuscular septum, that is posterior descending branch. This is posterior descending branch which is situated behind the lateral intramuscular septum. And there is anterior descending branch which pierces the lateral intramuscular septum and it becomes anterior to this. This is anterior descending branch. So profunda brachii here gives posterior descending branch. This is posterior descending branch, and here is anterior descending branch. It gives another branches also. Here is ascending branch or deltoid branch. Now this is brachial artery. Here at the level of radial tuberosity, it divides into two terminal branches. This is radial and ulnar. This is radial, this is ulnar. This ulnar gives a branch known as common interosseous branch. This branch is known as common interosseous branch. Interosseous branch. This is common interosseous. This common interosseous divides, gives two branch. One branch lies anterior to interosseous membrane. This is anterior interosseous artery, and one lies behind this, that is posterior interosseous artery. So this is posterior interosseous artery. Posterior interosseous artery. So common interosseous divides and gives anterior and posterior interosseous artery. And this ulnar artery gives another branches, which is anterior ulnar recurrent branch. This is anterior ulnar recurrent branch, which anastomoses with inferior ulnar collateral branch. This is inferior ulnar collateral branch, and this is anterior ulnar recurrent branch. This anastomosis is present on anterior part of medial condyle, epicondyle. And another branch here is posterior ulnar recurrent. This is posterior ulnar recurrent, which anastomoses with this superior ulnar collateral. This is posterior ulnar recurrent, which anastomoses with superior ulnar collateral. This is anastomosis towards the medial side, and towards the radial side, towards the lateral side. Here is posterior descending artery and anterior descending artery. This is anterior and this is posterior descending artery. Radial artery, here is radial artery, gives a branch. This is radial recurrent branch. This is radial recurrent branch, which anastomoses with anterior descending branch of profunda brachii. This anterior descending branch is also known as radial collateral artery. So this is also known as radial collateral. This is radial recurrent. So it anastomoses anterior to the elbow joint. And posterior to the elbow joint, here is posterior descending branch, which anastomoses with a branch arise from posterior interosseous artery. This is posterior interosseous artery. It is interosseous recurrent branch. This is interosseous recurrent branch, which anastomoses with posterior descending artery. So it lies behind the lateral epicondyle of the humerus. So this is anastomosis around the elbow joint. Sometimes this supratrochlear, this anastomoses with the posterior descending branch. This is known as olecranon anastomosis. It passes behind. This is known as olecranon anastomosis. So medially and laterally and posteriorly, sometimes this anastomosis is also present. So this is all about the anastomosis around the elbow joint. Just now we'll discuss about the elbow joint upright aspect. Here you have seen this is radial collateral ligament. Here is radial collateral ligament. This is ulnar collateral ligament. Here is ulnar collateral ligament. This is ulnar collateral ligament. In case of tennis elbow, this radial collateral ligament becomes sprained. Some fibers of the radial collateral ligament become damaged, and also the muscle takes origin from this ligament, that is extensor carpi radialis brevis. Some fibers of the extensor carpi radialis brevis may damage, which causes inflammation at over the lateral epicondyle of the humerus. So this area become painful in case of tennis elbow. In case of golfer's elbow, this ulnar collateral ligament fiber become tear, and also the muscle takes origin from medial epicondyle and this ligament. These are common fracture origin muscles. These muscle fibers are also teared. So in case of golfer's elbow, this area become inflamed and painful. In case of inflammation of olecranon bursa, here it is usually common in students, so it is known as student's elbow. In case of supracondylar fracture of the humerus, the median nerve is most commonly affected, and sometimes brachial artery may damage. So this is all about the applied aspect of this elbow joint.